Hello, my friends, and welcome back. Welcome back to another session with the older man. Today, we're going to talk about something quite sensitive but important. We're going to talk about erectile dysfunction. Yes, every man's nightmare for sure. And this subject came up for two very specific reasons. One, I had a gentleman last week who called me on this issue. He's over 60, but he's fit, he's in good shape, he's doing everything right, but he don't have a permanent lover. But lately he's realized that it ain't happening. So I'm going to approach this subject from two perspectives. One from a mental and the other from a physical. Because those are basically the only two issues that you will have with erectile dysfunction. Or I'd like to say erectile malfunction. Listen, let's make light of it. And listen, guys, I know a lot of you are Americans, and I know you all like to think about everything from a let's take a pill perspective. Yes, Viagra is there, but that is a band-aid to the problem. And it won't solve the problem if you're not mentally there as well. But listen, I'm getting ahead of myself. But before we get into it, you know what I'm going to ask. If you've been here before, subscribe. And if you've already done that, please give me a thumbs up on this video. All right? And of course, if you haven't already joined me over on Instagram, where you can send me voice messages, ask a question and get a quick response, you should be doing that right now. And even better, if you have bigger problems, listen, book a chat with me over on askanolderman.com. All right? All right. So let's get into it. First, we're going to listen to the doctors from Mayo Clinic. So they're talking about it from a medical, more of a physical perspective.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
More than 30 million men in the U.S. are living with erectile dysfunction. Heart disease and diabetes are two of the major risk factors, but unfortunately, the biggest risk factor is age, and you can't do much about that. More than half of men who are age 50 experience ED, and the number jumps to 70% at age 70. I guess that's not too surprising. Remember, Dr. Joyner just a few weeks ago told us that 50% of 70-year-olds can't get off the floor.
Yeah. How old are you again? We're going to talk about that? Okay.
Not telling.
While ED statistics increase with age, men don't have to live with ED. There are treatment options available. For many men, a physical exam and a medical history are all that's needed for a doctor to diagnose ED and recommend a treatment.
So, like I said prior, I'm a serious anti-pill type guy. If I cannot solve the problem naturally, meaning if I can't solve it naturally, that means either get my physical health in order or get my diet in order, I'm going to only use pills as the last resort. And I can tell you, gentlemen, ladies, 99% of your problems can be solved with diet and exercise. But because it's harder, it's not easy, most people tend to want the pill. And this is what I'm totally against. Anyway, let's hear what else.
Treatments can range from lifestyle changes to oral medications to surgical interventions such as penile implants. Here to discuss treatment for ED is Mayo Clinic urologist Dr. Toby Kohler. Welcome back to the program, Dr. Kohler. We love having you here.
Hello again. Thank you for having me back.
So much to talk about when it comes to the male, isn't there?
That's right. Very important information.
And this is a tough problem because it affects so many individuals. Everybody's living longer, and the statistics show that 70% of men age 70 have a problem with erectile dysfunction.
That's true. So, if you're 50 and you're in the football game, you look to your left or your right, one of those two guys is going to have a problem. So very pervasive, very common, and also an indicator of other underlying problems like heart disease sometimes. So that's why it's really important that we not only look into it and investigate it, but look for the underlying cause to treat it.
So what's the relationship there? You said it could be indicative of, for example, heart disease. How are they related?
Yeah, so, the penis is essentially the canary in the coal mine, as we like to say. The blood vessels that feed the penis are about 2 millimeters in diameter. and the blood vessels in the heart are about 4 millimeters in diameter. So whenever you have problems with blood flow to areas, the penis will act first because the vessels are smaller. So if the canary stops singing, there's a problem impending for the heart, right? Because heart attacks are common and can occur. So if you look at statistics, actually, in men age 40 to 50, the strongest predictor of heart disease is erectile dysfunction.
No kidding.
Wow. No, I didn't know that, guys. That is pretty scary information. I never looked at it from that perspective. You know, as someone who have always stayed in shape, and pretty much fitness have been part of my existence since high school, I don't know really any other way to exist. I don't know how it feels to be out of shape. I hope you understand what I'm saying. But I can understand why the statistics for physical ED is so high, because Americans, Westerners, listen, guys, we're out of shape. I'm a Westerner, just letting you know. So when I say we, I'm meaning the large percentage of the population. Not everybody is, but the large percentage of the population is out of shape, is obese. And of course, that's why the statistics are the way they are with ED, because most people are obese, are out of shape. But it's scary that you're going to get a wake-up call. You're going to get warned first where the penises start working. Woo, that's scary.
No kidding.
Why
What,
is it?
the canary stopped singing? That's
Yeah.
such a great way to put it. I mean, if you don't like the term ED,
Yeah.
you've got another way to tell it like it is.
Well, here's my question then. I mean, I suppose the answer is obvious, but if so many men experience erectile dysfunction, why is it so hard for them to come in and talk to their doctors about it?
Well,
Just one of those things.
it's one of
Yeah.
those things. Well, first of all, it's hard to get guys going to the doctor for
Here-
any problem.
Got it.
You know, but then, of course, it's a sensitive area. People are embarrassed.
Gentlemen, listen, man, especially as you get older, you guys have to stop this crap. You're not going to fix things. Your body isn't going to just fix things. You got to realize that, hey, when your body gives you a warning, oh, let me give you a great analogy. You know, when you're driving your car and that warning light comes on and you ignore it and you keep ignoring it, and it's an engine warning light. You don't ignore that shit. It's the same thing with the body. You feel something, oh, Christ, I never felt that before. That's a strange pain. Go get it checked out. Because most of us men tend to go, let me leave that. Keep an eye on that. And then all of a sudden, you think it's going to go away. And by day 3, 4, you get used to the pain. The brain becomes adapted to the pain. You honestly think it's not as bad as it was when you first felt it. That's the problem with us men. The body and the brain is adaptable. So it then becomes, you know what? It's not feeling as bad as it was, last week. It must be getting better. Then all of a sudden, 3 weeks have gone by, and then, you feel it again. And you say, I must be getting gas or something that aggravate the pain. And then all of a sudden, a month goes by, and you go to the doctor, and the doctor says, wow, you got cancer. Didn't you feel this? Because it's now have spread. It has gone into your liver, or it's gone into your pancreas, or it's gone into some vital organ. Why didn't you come? Didn't you feel this like a month and a half ago or 2 months ago? And you go, yeah, I felt it, doc, but I didn't. I just thought it would go away. No, that's the check engine light, my friend. You go and get that shit checked out right away. Especially when you're getting over 35, 40, you start taking that check engine light very seriously. Because if you live in an environment where you're getting shit food, no exercise, your stress levels are through the roof, you either got a nagging wife, the bills aren't being paid on time, you're stressing out at work, your diet is shit, that check engine light is going to come on if you're not combating these problems. So, gentlemen, please don't do that, man. All right, let's hear what else he has to say.
We often get the hand on the doorknob approach. So they'll list a litany of other complaints. And then as we're trying to leave, then they'll bring up this last thing. You have to have confidence. You have to go in there and say, Doc, I've got a problem with sex. What can we do about it?
Well, shouldn't primary care doctors then? I mean, if this is something that's so pervasive, wouldn't it just be something that they talk about? With when it comes to their patients?
Yeah, I think that's a very good plan. And that's, what your primary care doctor should be doing, actually, in age 40s and 50s, both men and women.
Typical female statement. Let's put the responsibility on someone else. Men, you're responsible for your own damn body. It's the same thing with prostate problems, right? By the way, I'm going to be bringing in a doctor, a urologist, and we're going to be talking prostate issues. Because me personally, I have an enlarged prostate. I've had an enlarged prostate since I was 36 years old. It started to get big from then. So now it's massive. But my point is, I asked my urologist, who I've been seeing for the last 8 years, if he would come on to a podcast and talk to men about prostate issues. Because, listen, guys, if you're 35, 40 years old and you haven't checked your prostate yet, especially if you're a black man, please do so now. Please do so now.
Did you know that 1 in 4 black men will get prostate cancer in their lifetime compared to 1 in 8 for other men? The exact cause for this is not fully known, but it might be linked to genes.
But anyway, I don't want to get into prostate issues in this segment. I want to stick strictly to ED. So all I'm saying is just make sure you go in and check yourself. Don't be embarrassed, man. We're over that shit at this age. You should be able to talk to your doctor about anything. This is the man that does everything to you. So talk to your doctor. Don't be afraid.
Sexual dysfunction will relate to depression, it will relate to heart disease, will relate to diabetes, all these other things. So those organs are very sensitive predictors of other problems.
So we've got a lot of medical options, which we didn't have before the medications came on the market to help with erectile dysfunction. They're pretty effective?
Yeah. Well, before we even talk about medications, we should first talk about lifestyle changes. So again,
Always.
It's always lifestyle changes. Yeah. Like if you exercise and eat right, everything gets better. I mean, that's the bottom line. A lot of stuff we do in medicine is a Band-Aid to allow you to exercise and eat better, like heart sense, for example. But if you lose weight, if you quit smoking, if you have a slimmer waistline, your penis will be better. I mean, I think, honestly, the cigarette carton should say, this is bad for your penis, and then less people would buy cigarettes. And indeed, in Canada, the picture on the side of the carton is like a kind of flaccid cigarette.
Oh my
configuration.
gosh.
Yep, they actually do tap into that.
Wow.
So smoking, obviously a huge risk factor.
Very bad. And as soon as you quit, you have as an effective improvement as if taking pills.
All right, but we've got this medical option, and I assume for some people it doesn't work or stops working over time, and then you've got some other things you can do.
Yeah, so lifestyle doesn't work, and then you can try sometimes pills. Pills will work in 50% of men, but they will stop working after about 5 years. Not because you get immune to the pills, but because you get sicker. The blood vessels get more clogged, other medical problems, rear their ugly head. So
now that's interesting. Did I hear you say that the pills, on average, work for just 5 years?
Because the pills are simply a Band-Aid. It doesn't cure the problem. The disease is still there. The problem is still there. You're just putting a Band-Aid over it and just stopping the bleeding, but the problem is still there. This is what a lot of people don't understand. It feels like you're okay, but you're not. And over time, if you don't have lifestyle changes, that disease is just going to get worse. Just want to simplify it for you guys so you can get this clear in your head, that you've got to heal yourself. The body is an amazing mechanism, and it has the capability of healing itself. You have to put in the effort.
Well, then you've got essentially two options left that potentially could work. One is giving yourself injections into the penis, which sounds scary and painful and horrible, but is actually very doable and works. Or you can do a surgery. The surgery is called...
Now the injection, what do you inject?
You inject Viagra or, these oral medication-like medicines directly into the penis, and they're much more effective because they're in higher quantities.
Big needle or...
Tiny needle.
God.
Diabetes needle. Tiny needle. Most guys rate their pain on a scale of 1 out of...
This guy's like, how big is the needle, man? I need to know. But there you go, gentlemen. There you go. Lifestyle change, surgery, pump, or you inject stuff into your penis. Those are your choices. All right, so now we're going to turn to the mental part of ED. And for that, I'm going to go to one of my favorite content creators, and it's Karen Scheitz. Could never pronounce that word. And she's from the Happy Wife School. That's her channel here on YouTube. I'll put a link to this video, of course, in the description of this video. So let's hear it from one of our favorite female male supporters.
Erectile dysfunction and the 3 reasons that women cause ED in men. And I'm looking forward to getting into this because this is a prevalent issue, and I want to connect some dots and kind of have us have a duh moment on where ED is coming from in the context of relationships with men and women. I am talking about the psychological, emotional aspects of ED. I am not talking about the physical, medical aspects of erectile dysfunction. I'm solely talking about the psychological, emotional issues of ED. And what's important to know is the Mayo Clinic and many other reputable health resources know and have established that there is a clear link between emotional stress from relationships and marriage and ED. And from my perspective, that's where I see ED coming from. It is not a physical disorder. It is an emotional disorder. And WebMD says the 2 top ways to resolve ED are marriage counseling and psychotherapy.
And I will pause with her there because she's quite wrong. It's not the only reason. Of course, the medical is different, but there is a third issue. Erectile dysfunction, part of the process of getting horny is testosterone. Testosterone is that hormone that we produce a lot of when we're young. And the reason why men have a bigger problem as they get older is because we produce significantly less testosterone as we get older. Testosterone is responsible for taking a child to a teenager, and then a teenager to a man. And he produces the maximum amount of testosterone in between the ages of 15 and 21. So guys, listen to this fact. That is why in some cultures, it is forbidden for young people to start drinking until after the age of 18. For other cultures, it's 21. Same reason why they don't want you on the road that early. Because this testosterone burst is what makes us feel invincible. That's why they want young soldiers, not old soldiers. That's why they want young athletes. They're literally bursting with testosterone. By age 25, that testosterone drops off because the boy has already stopped growing. And every 5 years, consequently, it literally drops and it drops and it drops and it drops. And it keeps going. That testosterone is responsible for keeping it hard and always horny. That's why teenagers are always so bloody horny. That's why they can go 4, 5, 6 rounds and wake up and not have a problem. Testosterone. This is the key. So how do you get testosterone? Because testosterone is a growth hormone. And the major purpose of testosterone, it's responsible for building muscles. That's why bodybuilders use testosterone when they are working out if they want to get amazing results, because it's a growth hormone. Taken in the right proportion, your muscles grow faster, you feel more aggressive, you feel alive when you're in that. You feel like a warrior when you're in that stuff. The issue now is that as we get older, we have less and less of it. So it's harder to physically keep the old boner as hard as it should be. To reverse that, you get to the gym and you lift weights. This is another primary reason you got to get to the gym. You're forcing the body to produce testosterone to build the muscles that you're pumping in the gym. When I walk out of the gym after doing a leg day, deadlifts, squats, heavy compound exercises, Oh man, I am horny as hell. Wifey gets in trouble, man. Oh gosh, yes. I'm just telling you, man. Horny as hell. My leg days, I come home, I'm up and I am up big time. It's crazy. I've never, ever, ever had to take one of the blue pills. Never in my life. A lot of my friends have, but a lot of those friends are out of shape. Never looked at the stuff. Because I've always kept in shape and I've always lift weights. Running won't do this for you, by the way. Swimming won't do this for you. Cycling won't do this for you. You have to lift weights. You have to force the body to grow muscle. And that will tell the body, in order for me to grow muscle, I need to produce testosterone. All right? Now, it's not going to produce a lot of it in your old age, but it's going to be enough to keep that baby up. Understand that when she says, the mental part is the only reason, no. All right, let her finish.
So what I want to present today and the connection I want to make and why counseling and marriage counseling and psychotherapy and from my perspective are not the best ways to resolve ED. I want to give a different solution. So stay with me because that's where we're going near the end of the show today. But I want to make the connection today. To me is a duh moment, as my mentor would say, the duh moment in making the connection that the emotional stress that causes ED for a man, the emotional stress from his relationship or marriage that causes ED is coming from emasculation. That his wife's emasculation of him is the primary cause of erectile dysfunction. And the problem with marriage counseling or psychotherapy being a solution for a man's ED is that psychotherapy and marriage counseling do not know to look at a woman's emasculation of her husband.
If you watch my previous videos on going to counselors, counseling is very gynocentric. First of all, most of the counselors are females. It's a very high number. And the whole psychotherapy system is based on how do we keep the woman happy. Men have to change their behavior in order to appease the wife. It's very female-centric. So what happened now is that the man now has to become more emotional, more soft, more understanding, more emotionally connect. All of these are female traits. So what she's saying is correct. So if I, as a man, have to become more feminine in order to appease my wife and bring harmony to the relationship, I am becoming more of a female. Females do not produce testosterone. So I am going into my feminine state as I stay in a relationship where the woman is constantly emasculating me. So psychotherapy don't work in its traditional sense when the man now has to become the woman. I mean, listen, you go, and I will put up some stats here. The testosterone levels in men have dropped so low because number one, men aren't getting sex. If men aren't having sex, their testosterone levels are going to drop because you have what you call the use it or lose it principle of life. This applies to everything. If you don't use your body, if you don't run, you'll never be better at running. If you don't practice and use your brain, the brain goes dull. If you don't lift weights, you'll never get muscles. You'll lose muscles, atrophy. Use it or lose it. If you don't have sex, the body does not produce testosterone in order for you to get more horny. The body says, oh, well, I don't need this. Well, why am I going to produce any? Sperm counts are at an all-time low.
Researchers have found that male sperm count has plummeted by 50% since the 1970s. But why?
So people aren't producing sperm because they're not using it. Men aren't having sex. Yes, the top 20%, the chads, yeah, those guys are popping it out left, right, and center. But the guys that are not getting sex, they're not getting, they're in trouble. Sperm count's low, testosterone levels are low. Men are becoming more feminine. It's not rocket science, gentlemen, not rocket science. Bottom line is, is that if a woman keeps emasculating you as a man, this will bring down your testosterone levels. And in turn, your testosterone levels drop, your sex drive drops. Your sex drive drops, you go limp. It's a simple, basic equation. Couple that with the woman who used sex as a manipulation tool, kills it even more. If you or anyone that you know is suffering from this problem, I know a lot of men don't talk about this shit, but I do get the calls coming in. Ladies, if you have your husband who's suffering from this, make sure that you stop emasculating him. Make him be a man. You cannot kill the man and then expect the dick to stay hard. You cannot do that, because those two things go hand in hand. Gentlemen, if you're having problems, the first thing you should do right now is get your ass in shape. But more importantly, get in the gym and start lifting some weights. And then try quickly as possible to go as heavy as possible. That will kick back in your testosterone levels, and then you will see the difference. Start masturbating more and more if you don't have a permanent woman. The reason for this is the use it or lose it principle. Because if you haven't been using it, my friend, it's gonna stop working. You gotta do whatever it takes. Stop smoking. Stop drinking so much. Cut out, slow down on the marijuana and the drugs. Get active. So guys, listen, I'm gonna cut this off here. Subscribe, give me a thumbs up. Book a session if you need to. Get me over on Instagram if you have a quick question. All right? So I'll see you guys in the next one. And remember, always remember, whenever in doubt, always ask an older man. I'll see you guys soon. Cheers.